morning, everyone. Welcome to CAHOCON. And thank you to a lot of people out here who, before me, have served Quality Council of India. Girdhar Gyani is here. A lot of people who are currently serving the National Accreditation Board for hospitals and healthcare providers, as well as the National Accreditation Board for Calibration and Testing Laboratories. Two of our champion accreditation bodies are here, and I'm sure that a lot of those are also here who left us and established a new accreditation body. Dr. Harana is here. So I wish you all well. There is no doubt that healthcare is a national priority, both at the national level, because you all know about PM's initiative for PMJY. And it is also, fortunately, a state priority. For example, in Telangana, you have this Arogyashri Yojana, which is being pursued by the state government. So one thing is for sure, that all of you, hold a very important place in the ecosystem of healthcare. Having said that, this particular ecosystem in the country is one which is in the eyes of 140 crore citizens of the country. And we, as a democratic country, somehow keep our ears and eyes open and criticize when we can and when somebody is listening. So, having done exemplary amount of work in the COVID times, India is on the 66th rank of the healthcare safety in the world. If you tell that to anybody, they will say that all these organizations who rank countries are a load of crap, because India has shown that it can not only help its own citizenry, it can help the world. And therefore, it is important that we pat ourselves on the back for a job well done. So thank you, all of you who are the frontline workers of healthcare. Having said that, I would, on CAHOCON, I would like to place my sincere gratitude to the leadership of CAHO, Vijayji, Lallu, for helping us out in doing something which was very, very, very difficult for us to do. In one state, we ventured to assess the nursing institutions in the country. And a lot of our CAHO friends who were not from that particular state contributed in assessing these nursing and paramedical institutions in that particular state. It was an eye-opener, and fortunately for us, the kind of ethics and morality that you have built in your members helped us swim through, and I'm sorry if somebody may object to my using the word, a very corrupt ecosystem in the country. We were CAHO people and assessors for offered money. When they did not accept, the money was thrown into their car. They were asked to keep a blind eye in the facilities that are there. Teachers, nursing practitioners were brought in a van or a bus just in order to show that they had one. Students did not know about their teachers or the principals, and anything and everything that you can think about going wrong into the system was there. So we were asked to rate these institutions. More than 30% are not institutions. They are called non-attending colleges. Non-attending means that you don't attend, you will get a degree of nursing, whether it is GNM or BSc nursing or whatever it is. 30% of those institutions did not have the requisite training aids, which our technical assessors in the nursing field told us. There were 40% institutions which were doing something, and they are the ones that we will have to build on in order to have a healthcare system that works. The second important point that I wanted to mention was, and this was primarily to tell you that sometimes in the country, for a good leadership, it is important to give power to others. Primarily what happens is that the leaders want to keep the power very close to their chest, and that does not help the ecosystem. And this is what we are telling to the government also, that please do not get involved in operationalizing things. Rather, it would be important for the government to only monitor what organizations like Quality Council of India or CAHOCON do as a third-party bodies. If that kind of a system can be built up into the system, where the government has trust on the domain expertise and domain experience of organizations like CAHO, like AHPI, like NABH, like NABL, perhaps this whole ecosystem will be better served. So sometimes these bold decision makings that the states show or the central government shows, where we are asked to deliver on something which is broken, is what we cherish most. The second important point that I wanted to focus on was that all of you who are sitting over here, especially in the allied healthcare field, you are the most important touch point in a healthcare organization, whether it is hospital or a clinic or a super specialty or a lab for that matter. And what is important for us to understand is that this healthcare system in the country would only have trust in the frontline workers when your communication is of that nature. The empathy that you show to the patients, although it is easier said than done, primarily in the public sector, because the load on the public sector is extremely high and people do get irritated. But important thing is that the nursing staff or the paramedical staff who constantly engage with the patients as well as their relatives maintain that decorum and that communication, which is most essential in establishing this trust of citizens with the healthcare system. We have been working on this, and I have absolutely no hesitation of saying that this is one of the improvement areas that we are working even in NABH as well as NABL, our two accreditation labs. Our Dr. Pawan Kapoor, the most important pillar of NABH from the very beginning. Dr. Gyani knows. He has been instrumental along with two more people. One is Anand and the other is, I don't see, Srinivas. He has not come? Okay. So, three of these important people are working on this, and we have had lot of success in the first two lead assessors or principal assessors training program, where we tried to tell them how to behave during an assessment or an audit. I would like all these accredited hospitals, the consortium of accredited hospitals, to give us the feedback of whether things are changing on the ground or not. If not, then we will have to make a little more effort. The third important thing was skilling. As I talked about allied healthcare professionals, there is no doubt that our medical education system is doing well. But the allied healthcare system, we need to create more people and capacity in having this healthcare system to be more robust. And therefore, NABH is trying to partner with HSSC, the Healthcare Sector Skill Councils, and we are trying to develop something which can take us through this important initiative of skilling of the allied healthcare professionals. The fourth important thing is how to, in fact, test your healthcare system. As you all might know, that there was very recently a global quality index which was evaluated out of 184 nations. Fortunately, India got the 5th rank in accreditation system, being dealt with by Quality Council of India, and it was a huge morale booster for an organization like Quality Council of India that our accreditation system is 5th in the world. But when we see that in the healthcare safety and security index, we are 66th, then it makes me wonder, should India not start ranking and rating other countries vis-a-vis the healthcare system which exists in India? Maybe we should start thinking about a global kind of a ranking for healthcare indices and start a competition among our own states first, although I know that Niti Aayog is doing that indexing, but a third party must do it. And maybe CAHO or HPI would like to take this initiative. And the last important thing is that, like we have done the ranking and rating of the nursing and paramedical institutions, we are also coming up with a ranking framework of hospitals as well as medical education institutions under NMC. I would seek your cooperation in doing that, especially with CAHO, because it's a huge initiative that NMC has taken for the medical education institutions. And Professor Narottam Puri is not here, but he has made a framework for rating of the hospitals which are accredited by NABH. So a lot of things are on the anvil, and I believe CAHOCON will discuss some of these initiatives that NABH and NABL have taken, as well as Quality Council of India is trying to take. Thank you very much.